amazing, and these are things that you learn over the course of time, right? I mean, these are things that you just learn that they're not teaching in hospitals. They're not. I mean, if you have you have students or nurses that are past students, which just goes to show again, if you can change some of the processes on some simple things like just monitoring the right things, that could save people. Let's talk a little bit about the pressure that nurses and providers are under, because you said there's a big shortage. You mentioned that they're hiring a bunch of nurses and they're really not ready, and when they get into the environment, it seems to me that if there's such a big shortage, they're putting a big load on patients. And again, it's I have the biggest respect for them because I've been in this situation so many times. It's like you can't expect that you're the only patient they're serving, because they're not. But talk a little bit about the caseload that they have. Are there things that can be done to help alleviate that? Not from a patient side, but just from a provider side.
Yeah, and I'm going to say, I guess I should have started out with this. Everyone that usually everyone that gets into healthcare because they want to help people. Nobody ever intends that they're going to harm people or leave out care that does harm people or make mistakes or errors. So I think the patient load out there is pretty heavy. California, the state I live in right now, does have regulations that regulate the amount of patients that a nurse can take care of. Other states don't have that. And so some states have heavier loads, which just makes it really challenging, because then the nurse is like very task focused, because I've got to give medications, I've got to check my labs. Oh no, this hemoglobin hematocrit was low. I've got to call the doctor. Now I've got to transfuse blood. I've got to check blood sugars. I've got to give insulin. It is a busy, busy time. I mean, I tell my students, get ready and put on your rollerblades, because that's what's going to take. The other kind of sad thing is we do our best in nursing education, but in the 15 years, and I've worked at probably 4 or 5 schools over that time, the students that I connect with after they've graduated and they start working, because I'd love to keep in touch with them, they'll say, school did not prepare me for this job. And now, after the pandemic, and a lot of the students missed key elements, but the boards of nursing approved video because we needed still to get these students through school, but there's a gap there. So hospitals have new grad programs, newly graduated nurses, but in cutting expenses, that's one of the places that some of them cut. And then the other thing they cut is nursing education in the hospitals. So I think there's a real big opportunity to bring essential education and annual education back to the bedside nurses, so they focus and remember, oh yeah, if I have a patient with a tube feeding, I need to make sure if I put the patient flat that I turn the tube feeding off, I change their bed, give their care, and put the head of the bed back up. Even just missing, oh, I forgot to do that, can cause harm. One of my clinical coordinators that I worked with at another school, it happened to her grandmother, and her grandmother aspirated and it killed her. We call it aspiration pneumonia. A couple days later, she couldn't recover. So there's no bad or ill intent there. It's just busy. So I think helping families understand how to partner with the healthcare system, to ask that question, hey, I understand my mom's head of the bed should be up if she's got a tube feeding, or can you check that IV? It's been beeping. Is it infusing correctly? I went over and touched her arm and it seems like it's swollen and cold. Just helping the nurses. And when you get informed, then you can help, because you know what to ask, and you know when something doesn't sound quite right, and then you'll know to escalate to get more help if you feel like you haven't been helped.
Right, and I think a lot of it is knowing how to ask, right? And expressing gratitude, I think, and real gratitude, because when we're in procedures with our son Nick, we know and we see, and I watch them because they're just like rollerblades, hoverboard. I mean, they're just all over the place, right? I've learned about the nursing shoes and which ones are the best because they're on their feet. But I think part of it is just expressing some gratitude if you're in there for a period of time, and then also asking in a way that's not combative. Some ways that you just mentioned, things just like, just help me understand, right? Just help me understand, or what, you mentioned this before, or the other nurse mentioned that before. And let's talk about that. Let's talk about shift change, because if you're in with some kind of critical, condition, and you're in for any length of time, more than a day, or even a day, you're going to have a shift change most likely. And let's talk about errors that occur during shift change, and then we'll ask some other questions about that. Let's first talk about errors about shift change.
Yeah, best practice is shift change at the bedside in front of the patient. Not everywhere practices that, but that's best practice. That means families that are there, or even the patient, when there's an exchange of information from the offgoing nurse to the next oncoming, then there is an understanding, then there's clarification, there's opportunity for questions too, which is great. So it should be pertinent information that's passed between, hey, their lab values were low, the potassium was only 2.9, so we gave a bolus of potassium, whatever that may be, updating, but also including pertinent information that's already occurred. Because it's ideal if the patient's going to be in the hospital 3 days, they have the same nurse, right? Because then you can get to know that patient, and then the family gets to know that nurse. But it doesn't happen that often, only because of varying schedules and shorter inpatient times in the hospitals. But the really essential information should go back and forth, but it not always does. So they should have notes that they record. Sometimes they'll write it in the chart and then they forget to communicate it, but it could be key information that would help move forward into better caring for that patient. So one of the examples I'll give you, there was a patient that had another knee surgery, and the offgoing nurse forgot to tell the oncoming nurse that the pulses were decreased in that foot and it was cooler to the touch. Well, the oncoming nurse got busy doing other things first because this patient was doing okay. His vital signs were okay. He wasn't complaining of a lot of pain. The epidural was working, but she forgot to go in and assess his foot. So I guess going back to your question about if we're having surgery, what should we expect? Again, where is the surgery and what are they doing? But in knee surgery, for example, this one, if there's a complication, or what we're going to watch for, number one, is perfusion back to that foot, right? And so by the time they figured out, it was the next day that the patient, he kept complaining of more and more pain, and they just figured, it was surgical pain, but it wasn't. It was pain because he wasn't getting perfusion to that foot. And because the nurse missed nursing care, and it wasn't passed on that this, hey, alert, the pulses are decreasing, they're not as strong as they were, and the foot's cooler, which should have flagged that to the oncoming nurse, like, I better go back, I better check that quickly or soon and recheck. So that's an example of missed information.